closing the door on the current Senate health care bill. Senate Majority Leader Mitch McConnell now says Republicans will try to repeal Obamacare with a delayed replacement. The move comes after two more Republican senators, Mike Lee of Utah and Jerry Moran of Kansas, said last night that they could not support this legislation, as you just heard, bringing the total number of no votes to 4, and of course that falls short of the number needed to pass it. For his part, President Trump urged lawmakers to move forward, tweeting this: Republicans should just repeal failing Obamacare now, work on a new health care plan that will start from a clean slate. Dems will join in. Well, that's the question now. If they were to start fresh, have a clean slate, do Democrats participate in governing? What do you think?
Well, I think they have to. I mean, I'd like to see the Republican Party get their act together and be a little more unified. And if the content's not exactly right, then get it right. But I really, you know, Tegan, you were talking earlier about the health care bill affects people as opposed to taxes. And here's a case where if you repeal it and you're leaving people vulnerable out there, I think there'll be more angst about repealing something and not knowing what's coming down the road if you get that delay 6 to 7 months.
Yeah.
As a citizen, I would be worried about that.
Yeah, and that is the political calculation right now, because you have 2018 approaching very quickly, and if these conservative senators do vote for a full repeal, then they've got to go back to those remember those angry town halls? Now we know a lot of that was grassroots and possibly from the left, but it was very bad press for the GOP. So whether or not it's coming from real conservative grassroots or the liberal left, if they go back and say we repealed this, we have nothing to replace it with, and this was already a very unpopular bill. It polled very, very poorly, which is one of the reasons why they couldn't unify the GOP coalition.
Well, it polled poorly because they couldn't explain it to anybody.
They couldn't explain it. They were totally off message, and but that effect is going to be the same one in 2018 if they repeal without a valid plan and good messaging.
There's a headline in the New York Times today that I absolutely, wholly agree with, that it's their news analysis, and the headline says, "The old truth trips up the GOP. A benefit is hard to retract."
Yes.
And this is a giant expansion of Medicaid. Yeah. And you have these Republican senators who, and the biggest voice in the nation has been John Kasich, the governor of Ohio. He does not want to give back the money, the expansion money, in any way, shape, or form, quite frankly, that was given to these states by Obamacare, even though it's not equitable.
Once you give me something, don't take it back. It's mine.
And also, there has just been a fundamental shift on a global level about how health care should be delivered to people.
The Democrats won on that.
Right? They have won, and so we are now approaching a truly fundamental shift in our health care, our entire health care system. And this is really health insurance reform. It's not actually health care reform.
It was never health care. It was always health insurance.
And so if you actually want to reduce costs, which is what people want, no matter what the insurance market does, you've got to address hospital consolidation, you've got to address technology innovation, you've got to address all of these things, which no one's even talking about.
The other thing that's not being addressed is we had, what, 222,000 jobs, right? So if you look the last 6, 7 months, people are getting employed. Don't know how much of that is being covered with health care as they get those employment opportunities, but that has to affect the whole issue when they talk about 10 million people unemployed, won't have insurance coverage. As jobs are created and we start to put people back to work again, my guess is some of those are going to be covered by insurance.
But as a businessman, Bob, when you were running Chrysler, when you were running Home Depot, when you were a senior person at General Electric, you saw the effect of the cost of health care.
Yes.
So characterize for us Obamacare on a business person and what that will dictate, how that will dictate your behavior in terms of hiring and investing.
Well, there's no question it added tremendous cost, right, as you look at it. As we were going through, before Obamacare, corporations across the country were looking at how you get more employee participation. In other words, copay. How do we work on copay? How do we look at reducing some of the cost of the drugs and what's being delivered out there? You know, we looked at trade-offs. You're exactly right. You know, when you talk about once you giveth, it's hard to taketh away, right? And so you're always looking for trade-offs. If we reduce this, what can we give you over here, kind of an offset. So it's really a critical part of running a corporation today.
And if you've got to spend X number of dollars on health care or benefits for your people, maybe you're going to hire less. Maybe you're going to invest less and put those kinds of big decisions off.
One company we were looking at from a private equity standpoint, you know, it's not that big a company, $40 million in workers' comp. and it's being covered by this insurance, either through the company or outside. So it is a big factor, right, in running a corporation today. Yeah. And you have to be thoughtful about your delivery. Megan, just like you said, you know, once you put that out there, nobody's going to want to take it back. Kasich's not going to want, I mean, his point.
The thing is about Medicaid. Medicaid has grown so much over the last 8 years. So you say, you know, once you give it, you don't want to take it back. But the truth is there are many people in the Medicaid entitlement program right now that shouldn't be there.
That was the strategy of Obamacare is that you make Medicaid available to a much larger part of the American population. So it isn't just for the disabled and the very poor and impoverished women. It is for it's the largest single insurer in the world. It's bigger than the National Health Service in Britain, number one. It's grown to like 75 million people in the United States. So essentially what this Republican bill in the Senate was doing was it was raising taxes. It's standing by Obamacare taxes while to help pay for insurance for able-bodied working adults. Yeah. That's what it was. Rather than changing the health insurance system so health insurance becomes more affordable for those very people and putting the burden on them to actually go out and buy health insurance for themselves, they're providing them with government health insurance. Right. And I think that that's the kind of ideological divide that you saw develop with
and even within the GOP
Rand Paul.
Even within the GOP, it's so divided. And fundamentally, ideologically, there's not a lot of shared values here in the GOP right now, and that's going to be
what Dagan is saying, that needs to be messaged out.
Yes.
Somebody needs to explain, no, we're not cutting Medicaid for the impoverished, for the blind, for the pregnant. This program has expanded, and we're trying to get it back to size.
And in fact, what the idea was is that the states are reimbursed for the traditional Medicaid recipients. They're reimbursed at about a 52% rate by the federal government. But with the new enrollees, these able-bodied adults, they were being reimbursed at close to 100%. So they were trying to create some equitable divide between and force the governors to make hard decisions about how are you going to cover these individuals and provide for the most needy.
Right, and the most needy, we're getting the short end of the stick.
You see this all the time in corporations. It's called creep. Whether it's salary creep, benefits creep, you know, year over year, you never go back to zero base. You know, I say, well, we got to give a little bit more. There's an entitlement culture out there.
You know what
always
changed,
creep.
You know what changed that in corporate America? The financial crisis in 2008. You saw a lot of corporations right-size their businesses.
Yes.
And
they were forced to. Yeah.
That was a crisis. Well, this is a crisis in terms of health care costs in this country and the loss of access to health insurance. And you know what? It just shows the difference between private business and government. Government doesn't treat it that way. Private business, they right-size immediately.